Welcome to this new episode. Now we will see the treatment always from a muscular or articular point of view, but from the, let's say, extraoral part. Therefore, we leave what is the oral cavity and focus on everything that can disturb the specific area of the mouth or jaw and could have a very distant origin, such as the spine, pelvis, diaphragm, or everything related to the visceral cervical space. There is the part of the tongue, the hyoid, and the entire anterior musculature of the sternum. So, as a very simple first approach, I suggest you immediately investigate with a normal tongue depressor what might be the tension of the floor of the mouth. There is this area down here. The test is very easy. We will work first on the side and then the other. We will rest the tongue depressor directly in the mouth, exactly on the tongue, and press on one side and the other, and feel with both fingers if this pressure is transferred to the reference fingers or not. If I feel that when I press, my fingers go down, I can think that this side of the floor of the mouth is free or not. At the moment, when on the contrary, when I press and do not feel the response of my fingers down, then I know that the floor of the mouth could be tense. Something very easy. Relax, one side or the other, in a very simple way. If movement occurs, it is a good sign. If it doesn't, I already have an idea of the dysfunction. I can do the same looking into the main organ that we have inside the oral cavity, which is the tongue. Just as an observation, remember that the tongue begins to form in the 7th week of the gestation and is fully formed as it functions before the 12th week. Therefore, when a woman is pregnant, in the 3rd month, the tongue is practically formed, and it will be the tongue that will create the entire oral cavity and specifically all the structural architecture in relation to the oral cavity. A very easy test that you can do with a gauze. Obviously, to be comfortable, we will ask the patient to pull out the tongue